Hello, America. My name is Doc Holliday. I wanted to come on to talk to you again about about the coronavirus. If you see any little, how do you say, snake food running around over here, don't worry about it. It's only snake food. We're pets. But anyways. Again, coronavirus. We got a lot of issues. Of course, everybody knows we got the Delta variant going around right now. I'm going to see if I can do this here. One second here. All right. So, we got the coronavirus, Delta variant. 10 days is going to be at 100,000 people a day is going to be walking around here catching this new variant. Because largely there's no change in strategy with the change administration. We're just going about the same mess and thinking that, the vaccine is going to solve everything when people are not actually taking the vaccine, because people are not taking the virus serious anymore just because of the mixed messaging that is going on with those people that are in charge. So fire Fauci. Of course, that is the number one thing that you should do in doing and correcting what is going on. We have to fire Fauci. We have to change the messaging that is going on as it relates to the coronavirus and actually fighting this. I've already dealt in previous videos about just because of the fact that Fauci was more aggressive than Trump in trying to fight the coronavirus, that doesn't make him win any freaking awards or whatever. He did not do any stellar job when Trump was in office, and he still isn't doing a stellar job with Biden in office. So he needs to go. In addition, the CDC Director, Rochelle Rollinski, she needs to go too. She is one of the chief reasons why. She is the chief reason why people are not getting the vaccines right now, because her dumb butt is talking about, oh, well, you don't have to wear any mask. Those people that are not infected, you don't have to wear any mask. You are an idiot, Rochelle Rollinski. You are an idiot. And let me tell you, I've seen a lot of dumbass, I even got the notes on here. I've seen a lot of dumbass doctors in my lifetime, and Rochelle Rollinski, you are definitely one of them, because there is no way in hell that you can actually, there's no way in hell that you can actually tell a population that you don't have to wear a mask to prevent the infection, while also trying to convince that same population to get the vaccine to prevent that same infection, i.e. the nation's vaccine and mask policy for the youth. What the hell are you doing, Miss Walensky? What are you saying that kids that are vaccinated don't have to wear masks, or that the individual jurisdictions can decide the policy to implement the mask policies? Hello, did you just not witness what happened last year, you idiot? That's the same kind of crap they tried to do last year, and the population, the amount of people that were infected with coronavirus exploded exponentially. And now you're going to go and do the same, and follow the same playbook religiously? What an idiot. People, America, parents, please don't send your kids to school unless they are vaccinated and wearing a mask. Um, with over 65% of the population under 40 not vaccinated, the numbers get much worse as you get younger and younger. Because kids under 12, ain't 1% of them got vaccinated yet, because they're not even eligible for vaccinations. So then you're dealing with the 12 to the 16-year-olds, and you might have half of them that may have gotten one shot, maybe. And a lot of situations, they're not being forced. Heck, you even got states like Tennessee that just say, hey, I'm not even going to vaccinate the hell coronavirus. I'm not going to vaccinate you for any freaking thing. Forget what the hell science says. What the heck? Oh, that's a different story. We're going to stay on here. Michelle, what's her name? What's her name again? Rochelle Rollinski. We're going to stay on Rochelle Rollinski, because she's the one that created the national policy to say, hey, everybody, you just do whatever you want to do. I'm sure you'll be able to handle it, because that's what you get paid the big bucks for. Rochelle Rollinski, you're an idiot. I don't care how much they get paid. Unless them people are all saying, unanimously saying that you don't have to wear a mask, and I mean, they're unanimously saying that you do have to wear a mask and that you do have to go and get a vaccine, then no, you are failing as a director of the CDC, and you need to be fired too. So the other thing is, the people that are getting the most vaccines are the more affluent and are living in the more educated areas of the country, affluent and educated areas of the country, meaning like, New York, Jersey, D.C., Pennsylvania, California, Florida, Michigan, Washington State. Those type of places, they are getting more vaccine because more people are more educated. You have a much more college-educated populace to where they're going to be more likely to get the vaccine. Whereas you have states like Mississippi, Arkansas, Louisiana, Alabama, those areas in which, South Dakota, North Dakota, in which you have people with lesser degrees or less college educated people there. They are not getting the vaccines, and of course also your poor communities as well. They're not getting the vaccines. So you have a problem with those people being the more people that have more congested, more multi-generational family members living within the same households. So that is going to just cause a lot more spread. And it's irrespective of whether or not you get the vaccine or not. If you got the vaccine, you still can't catch the COVID infection, and you can still transmit the COVID infection to other people, regardless of whether or not they got vaccinated or not. So it is still transmissible, even if you have received the COVID vaccine. So, all people need to be actually wearing the mask, not just the people who did not get the vaccine. Everybody needs to wear the mask, because everybody can still catch the virus. Now, some people will say, well, if everybody can still catch the virus, what is the reason why you are imploring everyone to get the vaccine? Well, the reason why I'm still imploring everyone to get the vaccine, and I'm singling out Moderna, because that's the one I got good results with it or whatever, and I ain't heard nothing bad about it. So I'm singling out Moderna. Go get the Moderna vaccine, and It's a two-shot vaccine, and um, the reason why you want to get that is because it will actually prevent the the virus from actually killing you, or causing you. It will prevent the virus from having enough ability to reproduce itself to it will prevent it from being more dangerous or more deadly to you, to where it prevents you from actually having to go to the hospital to get treatment, or to where if you were to just get the vaccine, you know, you may just have like what some people describe as a summer cold or seasonal cold and everything, which would be perfect. But the thing about it is, if you have a child that is in your household that is not vaccinated, he can still catch the virus as well. And true, you know, he may not have the more severe complications. He may not die, he or she may not die, but remember, the long COVID is a very debilitating possibility as well. So you don't want to do that. And in addition to that, what happens is, the more this virus is able to regenerate itself, is to transmit itself from one person to the next, it allows that person the ability to roll the dice and possibly become a virus that is able to totally bypass the vaccines and do real damage to everyone. So this is something that you know, everyone must realize as well. Now, the final thing I want to say is, which is probably the most important thing to say, and I hate that I said this to last, but the most important thing for us to do right now is to upgrade our mask, because the mask that we are wearing right now was not good enough to prevent the prior versions of the coronavirus. And if it was not good enough to prevent the transmission of the prior versions of the coronavirus, it is not going to be good enough to prevent the current versions of coronavirus. So therefore, what I mean is, do not just go simply and use a cloth thing or whatever and pull it down every once in a while, drink you a sip. Look, you got to be more cognizant of what you are doing, because if you are not, your mistakes could kill you, or it could kill some of your family members. So again, I just recently went and bought some N95 magazines, masks, and I have like one of them here. These are disposable. The ones I have that I'm going to be ordering, they come in the little plastic sheet. Now, these are one types of things that you can use just while traveling, just like to and from, just to make sure you have something on your face. But if you're in a lot of people, if you're around a lot of people, you need to wear something that completely seals your nose and your face. And those are some that you'll see in my previous videos. Check some of my previous videos, and I will and I have the links to the different how do I say, masks that you could buy from Amazon and such. Because if you do not upgrade your mask, unless you're how do you say, hibernating and keeping yourself away from the public, you know, you are putting yourself at risk of catching the disease. So, you know, just please keep that in mind. You know, gosh, I'm hoping that if you see this video, that you will contact the people at CDC, that you'll contact your congressman, your and everything, because like, okay, 10 days, I said 100K per day is going to be having this disease. Now, 30 days from today, today is the 22nd in the morning, 9 o'clock in the morning on July the 22nd. A month from now, August 22nd, if by August the 22nd, the CDC doesn't issue some kind of new guidance and everything, saying that everybody must wear masks and everybody must get vaccinated, we're going to be pushing 200,000 a day that are going to be catching this disease. And, you know, like I said, we those are levels that we're not going to be able to sustain. And the longer that we allow this to go on and to precipitate, remember I told you in other videos that it's going to take us 3 years to get rid of this virus. From whenever we decide to actually start fighting it for real, that we want to eradicate it, it's going to take us 3 years to get rid of it. Now, in order for us to actually really put forth the effort to really want to fight it, we have to pick up our ability to manufacture the vaccines. We got to get a lot more distribution centers and processing, or whatever you call it, manufacturing centers, not only throughout the United States, but throughout the globe. Because we have to saturate the market like instantaneously, not over the period of 5 years. So we have to get a lot more production capacity available. We have to squash all of these what do you call it? Gosh, what do you call them again? The patents. We have to squash all of these patents that different countries have, so that we can get the market fully saturated with enough product and supply to make sure that once we get our capacities up and build them up, that we are able to tackle this stuff. Because right now we're not doing the job that is necessary for us to get ahead of the game on this. Because once we put out fire here, you got another fire over there. You put out fire there, you got another one over here. No, we gotta have to blanket the globe with a lot of the antiviral vaccines in order for us to be able to defeat this. But in the meantime, in between time, in order to keep our economies from going down dramatically, we had to, while, you know, America does have the vaccine capacity, we need to mandate that everyone in America needs to take the vaccine. Point blank, period. And like I said in other videos, you can find them or whatever, if they don't, because, you know, this is no game. This is really no game. And a lot of people have said in my other videos, oh, would you try to be totalitarian or whatever? Well, to that I say, listen, we already are making you taking polio and all these other vaccines every year that would give cause to a lot of diseases and despair that would be on a lesser level than what we have here with the COVID. So if we can make your behind get the vaccines or whatever for those diseases, we can also do it for these ones as well. And like, we would have to just enforce it. Like, you can't travel, airlines, buses, you can't pick up your check, you can't, you know, do whatever unless you got that little thing that says, yes, I've been vaccinated. Because, and, you know, you have to give people, you know, once the new thing come out, okay, you get 2 weeks to get this in. Actually, probably less than that, but 2 weeks just depending on how the uh, the supply, the vaccination supply, and the disbursement, how we're able to facilitate that going forward. But yeah, I mean, we really, really, really have to get on this. But you know, everybody will see why I put the urgency on this matter in the days, months, unfortunate years to come. It's again 3 years. It's a long time, but that time hasn't even started as of yet. Hopefully, you know, the middle of next year we will be able to build that capacity up, and hopefully the virus has not mutated into even more deadlier version than just this deathly version we got right now. You know, but in the meantime, between time, please everyone, upgrade your mask, continue to social distance. Do not attend any gatherings that are large. If you have children, do not send them to school. If you're, you know, try to make sure that you can get yourself vaccinated and everything, and continue to wear your mask, and continue and contact you know, your representatives and everything, and tell them that you need to get proper representatives that are actually looking out for your best interests, for the health of the community, not just for the pockets of the elite. But thank you. God bless. Talk to you soon. Bye-bye.